Welcome to episode 12 of the Autumn Brookman Show. Today we've got special guest Dr. Ben Rall, so let's get started. All right, thanks for joining us for the Autumn Brookman Show. Today we've got special guest Dr. Ben Rall with us. So Dr. Ben is an author, a chiropractor, a podcast host, and thank you so much for coming on to join us today.
Oh yeah, very excited. Thank you for having me. I love your show and love what you do, so excited to chat.
Well, thank you. So before we get into some questions I've got, could you just take a minute and introduce yourself and just kind of share who you are and what work you do?
Sure, yeah, thank you. So I'm a chiropractor. I've been doing this for about 20 years. I've had different offices in different places. I'm originally from the Midwest. I'm a dad. I'm married to an attorney, and then I have a couple of kiddos, a 17 and a 15-year-old. So I'm a dad. I'm a husband. I practice holistic health, and it's really been my passion for a long time of having people understand that view of holistic living. Also, I'm a person of faith, and so that whole kind of ball there is really kind of what I do. And then things got interesting, of course, these last few years, through, everything that went on there. So, just trying to, juggle all those plates. And we have our podcast as well, Designed to Heal. And so, just one day at a time, but that's kind of who I am.
Well, thank you. So you just brought up Designed to Heal. I was going to ask you that name, Designed to Heal, that's the name of your most recent book and your podcast. Could you share the significance behind that name?
Yeah, so I certainly didn't. I don't think I coined the term, by any means. But the wake up call for me was when we've heard those sayings, right? We all understand to some degree where maybe we were created or created in the likeness and image of God, or however you kind of say that. When I was in chiropractic school, one of the first things you do is you do a human dissection, right? So you work on people that have donated their bodies, and you spend about a year and a half, it's part of your training, on dissecting the body. And I so vividly remember when we opened up the body, and I'd seen pictures, and you have all the anatomy textbooks, but I'd never seen it like that. And it was in that moment, Autumn, where I was like just overwhelmed with this reality that we are created. It wasn't an accident. You don't see a heart sitting up against the lungs, pressed up against the diaphragm and the stomach and the vessels and the nerves and the muscles. You just go, how did this happen? Right? And so in that moment, I would say it just really, got into my soul almost, that we're designed, right? We're created. And then because of that, you don't have to live too long to realize when you cut your hand, it heals, not because you have a Band-Aid, right? Or if you have kiddos or you get a cold or whatever, and you watch your body just heal, And again, fascinating. You eat your cheeseburger, and the next day it becomes your, whatever, your body's repairing. So those things just fascinated me. And then I think pressed up against this idea that there's a message out there that's almost trying to tell you the opposite all the time, right? Like you're designed to almost to die, or designed to fail, right? There's this other narrative that presses against this truth that our bodies are the most incredible, self-healing, self-regulating system. Now, the medical term for that might be called homeostasis or negative feedback loops. The reason we can sit here right now and have this conversation, and I'm in a 72 degree room, and my body temperature is not 72 degrees, is not because I'm thinking about it. It's because my body's natural, divine design. And so just in simple terms, I call that Designed to Heal. And that's really the message that I try to teach people. You saw, again, we talk about these last few years, we saw that reality get really beat up for so many people, right? They were living in so much fear. They're walking around afraid of the air that God put in front of them, right? And these types of things, afraid of their kids, they're afraid of their grandparent, they're afraid of things like this. And so I was just telling the story the other day, during those times, my wife was at Trader Joe's doing some shopping, and she wasn't wearing a mask. And one of the managers came up and sprayed my wife with a disinfectant, like she was some sort of contaminated, whatever specimen. And so again, the misunderstanding of that we're designed to heal will then allow us to do some really ridiculous, dangerous things because out of fear. And so, right, that's the devotional that we wrote. That's what our podcast is called. And about 90% of the time, I'm wearing a shirt that says "Designed to Heal." So that was a long answer to your question, Autumn, but that's the answer.
Well, thank you. It's a good answer, and very relevant with everything like you mentioned. Just the fear that's been in our culture and people making these fear-based decisions and often the wrong decisions. I did want to ask another question. This is from your website. It says that you're committed to educating and empowering individuals and how to apply a vitalistic model of healthcare. So I was just wondering about that term, vitalistic model of healthcare. What that means? What is a vitalistic model, and how does that compare to other models of healthcare?
Man, you're asking all my favorite questions, Autumn. I promise we didn't we didn't submit these, right? But this is so the opposite of vitalism, or kind of the other side of that, is mechanism, right? So mechanism would be we're parts and pieces. We're like a car, right? And so if your brakes go out, you just replace the brakes. If you need a new motor, you just put another motor in. Those kinds of things. Now, the opposite of that is this reality of vitalism, that we're more than the sum of our parts, okay? That we're not just parts and pieces. Matter of fact, a real simple way to understand this is a live body and a dead body, they have the same parts and pieces, right? But one has something else, right? That spark of life, right? Vitalism. Now, and we won't go into it, but there's actually some very important historical context where there was literally a battle in history between vitalism and mechanism, okay? And mechanism won out, all right, at the time. And there's a lot of reasons for that, where people, the constructs, I mean, if you look at our today's allopathic medical model, just the medical model, it's a very mechanistic, right? We're going to give you this chemical. We're going to cut out this part, this piece. Matter of fact, the desire of the healthcare model right now is actually more mechanism, right? We want to put more things in you, on you, around you, and fake hearts and fake things like that. And so the opposite of that is this understanding, like I mentioned a little bit earlier, that we're a self-healing, self-regulating system. Our body is designed to heal. We're more than just the sum of our parts. And so really my hope and prayer would be that we would have a healthcare model based on vitalism. Right now, here's the interesting part. Within vitalism, there are mechanistic aspects, right? If you break your bone, right, it's helpful that gets set back in place, right? It'll help it heal better. But interestingly enough, the bone will heal either way. It's just going to heal a little bit mangled, okay, and a little bit deformed, but the body will still heal. You can cut yourself and not get stitches and it will still heal. You might have a scar, but it isn't like it stops the body from healing. And so there's a small aspect of our healthcare that fits okay in a mechanistic model. That's your emergency care healthcare, which is about 2% of healthcare. The rest of it, the 98%, are the things we're talking about, whether it's heart disease or cancer or immune systems or diabetes or blood pressure, whatever you really want to talk about. That is a much better approach, is this reality of vitalism, right? That our bodies are dynamic, they're holistic, they're interrelated. Anytime you read a drug insert, you'll see how interrelated they are, because it talks about all the different parts of the body that they can affect, okay? And so I really do strive to have, when a person can understand you're not just parts and pieces, you're not just a machine, right? You're divinely created, likeness and image of God. It can be a transformative perspective for somebody to have. Because then when, again, maybe you have a fever, you don't go, what's wrong with me? You say, well, I know that my body is divinely designed. I know that it has this inborn, innate wisdom, and so it's probably doing the right thing, right? And so I'm not trying to figure that out. I'm trying to support that, to work with that. Let that vital energy, that whatever you want to call it, innate God, that type of thing, let that do the thing that it's been doing, the whole time you've been alive. Matter of fact, when you were 2 half cells came together, 9 months later you were born. No doctor did that. The great physician did that, but no doctor did that. And so I just try to help people, because that message isn't told very often, right? The message in traditional healthcare is, let's label you, let's diagnose you, let's put names on things, let's give you pills, potions, and lotions for that. Let's treat symptoms and not get to root cause. And that has been such a disaster for healthcare.
Yeah, lots of good points there. I'm thinking about some topics we have coming up, and so with what you've said. So the next question is kind of in the same vein, but kind of broadening from just the physical. Yeah. On your podcast, you said it's about how to heal or how to live better physically, mentally, and spiritually.
Yeah.
So kind of how does that mental and spiritual aspect connect with what you've been saying?
Well, I'm not a preacher. I don't pretend to be one, but to me, it's everything. It's how I operate my life. It's my foundation. It's not the cherry on top. It's not the extra. It's not, some little, it's not a small aspect of my life. It's really, hopefully it's everything that I do. To me, it's everything. And so now out of that spiritual connection, or again, however a person defines that, the physical, I think, is pretty easy to understand. Now, to your point, almost like a Venn diagram, I mean, they're super interrelated, right? Like physical, emotional, spiritual. I use this example sometimes. If my phone rang right now and I pick it up and it's my wife telling me some horrible news about one of my children or something like that, like those sound waves coming through a phone hitting my eardrum are going to likely create a very visceral response in me, right? I mean, I may faint, I might get sick, my heart starts beating fast, I start sweating. So I think to help people have that appreciation, because there's a lot of people that I might meet that are having physical health problems, and they want to ask me, hey, what vitamin should I take, or what detox should I do, or what extra, and those are okay questions to ask, but none of them get to the cause of the problem. If the cause is what we were just talking about, right? Certain stresses or habits that we have in our life. Some of them are habits we know we shouldn't have, and some of them are ones that we don't even realize or we don't know how to change them. But to me, the spiritual component is really where, back to this idea that we're created in the likeness of God. Like, why wouldn't we want, consistent communication with the one who made you and knows you better than you know yourself, right? He has plans and purposes for you that he created before he laid the foundations of earth. And so I would want to talk to him about those things, right? And I believe in the power of prayer. And I've seen it happen in my own life, my own practice with people. I've been several books on it. And, for people that this is new to them, I mean, I pray for all of my patients. Before we open my office every single day, we pray together as a staff. We pray for our patients by name. I pray for them oftentimes when I'm seeing them. It's not a requirement, but I can't not pray for them, right? Like I believe in that too much. Why wouldn't I invoke the power of God into those relationships? And then when you think about it from a healing perspective, right, he is the great physician. So again, it was a real transformative part of my life and I'll just tell you a quick story, but I've never heard the audible voice of God, but I've certainly had promptings, right, where you know that this is, not you thinking. And I just felt the Lord say one time, he said, you talk a lot about healing. This was years ago, but he said, but you don't talk a lot about the healer. And that was one of those moments that stopped me in my tracks, because the last thing I'd want to do is anything blasphemous or anything, trying to take credit. I don't want to be a money changer, right? I don't want to be, manipulating, or however you'd say that, like using God for my, my my whatever. And so in that moment, I decided I can't take any credit for any healing. I can't take any credit. My job as a doctor, my favorite definition is teacher, which is really just to let people know that they're created by God, right? Designed to heal and help them steward that well. And so that comes from my foundation of faith. So to your question, that's my everything. And then the other stuff kind of filters out of that. The physical part is honestly the smallest part, Autumn. Like, it's like the prism of light sometimes, right? The amount of light we can see, or the spectrum of light, is very small, the visible light. There's so much more going on that we have no idea. When it comes to our health, I would say it's very similar. We have this small little mechanical part that we can measure on blood tests, or we can measure on x-rays or MRIs or symptoms and objective findings, but that's like this small little part. There was a study out of Baylor University years ago. They said that we know less than 1% about the workings of the human body. I would say that's probably even rounding up. Okay, we think we're so smart. It's our own ego as people. We think we got it all figured out. We want to be God, but the reality is we really have no idea how most of this works. And even the things that we think we know are probably be proved wrong in 100 years. Right? We used to drill holes in people's heads thinking that we were going to cure them. We used to put leeches on people's skin. We've done a lot of ridiculous things. We gave drugs to people that caused deformities for morning sickness. I could go through all the medical failures over the years, and the likely is the ones that many of what we're doing right now will be looked back on as, I can't believe that we did that, right? And so, but until a person comes to that awareness for me comes through faith. The last part I'll say about that is ultimately this realization that we are only here for a period of time, all right? And so whatever that dash that we have in our lives, so many times We let fear, like you mentioned earlier, Autumn, we let fear drive us to make decisions that we wouldn't usually make, right? Like we'll be told, hey, take this. If you don't take this, you're going to die. And then out of that fear, we don't look into that. We just do what they quote say, right? And then we go, man, that maybe wasn't the best thing to do. So I think one thing that happened over these last few years, people really woke up, even people of faith woke up and said, man, I still have a lot of the world in me. I'm still chasing a lot of the world. I'm still so afraid of, I mean, honestly, these are heavy conversations, but I'm so afraid of dying, right, that I'm going to do this, that, and the other thing. And frankly, the words of Paul tell us very clearly, right? To live is Christ, to die is gain. Like, this world is not our home. But we don't like to think like that because it sounds almost, morbid. And I'm not like suggesting, taking our life cavalier, but I'm also not afraid of death. I'm just not. And so but that's partly why Christ came. And again, I'm not like a preacher here today, but it's so we can be free, right? And then that means a lot of things, right? And one of them is how we view this thing, right? How we view our health. Yes, we're called to be stewards, but we're not called for this thing to be an idol. We're not called for this. Your body, your health is not an idol. Your family isn't to be an idol. Your career is not to be an idol. And these are all areas of my life that I've had to get, humbled in. But another long answer to a relatively simple question there, Autumn. But
Well, your answer made me think of a few things. So first you talked a little bit about this root causes.
yeah,
And do you have any more to share, I guess, about why that is? I feel like when people have a problem or a symptom, like they're getting headaches or they're having pain somewhere, it's just an automatic to take something for it or
Yeah.
go see a specialist for it. And they don't always get to what could maybe be lifestyle choices or other things that are behind that. So why do
Yeah.
you think that is?
Yeah, no, it's a great question. I think some of it's certainly just like very understandable why that's happened. Okay, and then I think there's maybe another side that's a little more nefarious, right? Big pharma, big insurance trying to manipulate us. But so let's just take like maybe the easier side. I remember I was doing a talk one time to a group of retired pastors, and I'm originally from the Midwest. And after I talked, this old, I say old, he was like literally 90 years old, and he came up to me and he said, he says, Ben, everybody just wants a quick fix. This is what he said to me, right? And I said, well, that's okay. I understand that idea, but I said, we've been convinced that it's a fix, right? So often when we say those things, we don't realize kind of how ridiculous what we're saying is. When I take a pill to mask my headache, I did not fix the cause of my headache, but I may come to that wrong conclusion because I feel better, because my headache doesn't hurt or it hurts less. So we go, yes, it did. It worked. But we don't realize. And I always use this example. Forgive me for it being a little bit silly. But if I was really tired and I snorted some cocaine, I don't think anybody would think I found the cure for tiredness. I didn't need a snort of cocaine. I needed a nap, or I needed to look at my lifestyle. So we come to this wrong conclusion because these things sometimes seem to work. Now, they often don't work as well as people even believe that they do. And there's a lot of reasons for this, everything from placebo to, just a lot of things. So that's part one of it. But I think what's happened, and the other example I used for this pastor, I said, if I told you that I could take this piece of corn and grow an ear of corn in a week, you would probably tell me, even if I could do that, you'd probably say, that doesn't seem like natural, right? Like that shouldn't happen. I don't know if I want to eat that piece of corn that you could grow in a week. And so I think the same thing is, much of the ways that we apply healthcare to ourselves or things that we do, they might have good intentions, right? Like, hey, I have inflammation, so I take an anti-inflammatory, but we never asked, why is the inflammation there to start with? There's never been a headache in the history of the world that exists because you have a deficiency in Tylenol. There's never been a depression in the world that exists because you have a deficiency in Prozac. There's never been a high blood pressure condition or a cholesterol condition or a diabetes condition that is due to a deficiency in a drug. That's how this works. But we've been bamboozled to believe that we figured it out. And so I think, again, you have some sort of condition, named or not named, and you want the anti of that. I've got a runny nose, I want an antihistamine. I have a cough, I take an anti-cough. Something like this. I have diarrhea, I take, other way, I take something else. And because these things sometimes have effects, we believe that they're actually getting to the cause of the problem, but they're not. And that's a very astute point, Autumn. I mean, that's the point. They don't do what you think they're doing. So it's kind of this illusion, but you have to And so you have to ask yourself a couple questions. Why is my body doing that, right? And a lot of times the symptom is actually the body trying to warn you, right? Like say, hey, pay attention. Or it's actually trying to like help you, like, hey, your back hurts because you injured it. Like rest. You know what I mean? Like don't take a bunch of pills or a shot so you don't feel it and then go play basketball and think that that was a good idea. And so there's a lot of forces at work. Some of it's just ignorance, right? People don't realize that these drugs and these things aren't doing what they think they're doing because they think they feel a little bit better on them. They don't realize they're becoming addicted or they're causing other side effects and those kinds of things. And then you've got a very smart marketing people from the big pharma world that are telling you over and over and over and over and over, you need this pill, you need this pill, you need this drug, this is what you need. And they're really good at marketing. I mean, frankly, right? And so that's why, again, I talk so much about Design to Heal, because if you can have that perspective, you go, well, hey, my body's not doing this to hurt me. My body's not out, to give me a fever or give me a headache or have a cough, even a cough. I don't take cough suppressants, natural or otherwise, because I don't want to stop a cough. It's there for a reason. I don't want to lower my fever if I have a fever. I want the body to do what it needs to do. Now, some people think that's crazy. Some people think that's extreme. I think it's actually a highly intelligent approach, even though it might make me uncomfortable and things like that. But again, it's the body trying to say, hey, Ben, maybe take a nap. Hey, rest. You're burning the candle at both ends. To your point, what's your lifestyle look like? Are you eating well? Are you moving well? What's going on? And so I think it's done such a disservice because it's taken a lot of our, we have more faith in pill, potions, and lotions than we do in the God that created you, which is really heartbreaking.
Yeah, and this actually ties right into our next topic. So our next segment is called 2034 in the News. So 2034 is the name of a novel that we wrote.
Yeah.
And it's like this dystopian feel. So in the novel, when Georgiana's in school, like most of her peers are all taking something, right? Whether it's for anxiety, depression, ADHD, birth control, hormone therapy, right? Everybody's like on something. So I found this research or these articles that are kind of about mental health. So we see these headlines are kind of normal now, like teen mental health crisis deepens, what to know. Roughly 1 in 5 adolescents report experiencing symptoms of anxiety or depression. Young adults twice as likely as teens to suffer from anxiety and depression. Mm-hmm. Right? And they have these statistics like this one says from 2011 to 2021, the number of adolescents who had a major depressive episode had an increase of nearly 150%. It talks also about an increase in persistent sadness and hopelessness. There's data from the Teen National Health Interview Survey. It says 21% of adolescents ages 12 to 17 are experiencing symptoms of anxiety and 17% of depression. And then this one says adults ages 18 to 25 are nearly twice as likely as teenagers to suffer from anxiety and depression. So just given all of this, I keep seeing articles and headlines like this about anxiety and depression. Just what factors do you think are contributing to the high rates of anxiety and depression in our young people?
Yeah, so super important question. And I think there's a couple of ways that we can answer this, all right? So there's a few, I would just say, obvious ones that we would need to look at. Like screen times, right? There's the studies about social media, particularly with young women. I think it's across the board, but the one study that they've admitted to, right, is what it did to, pretty much a linear relationship to social media use in young girls, leading to depression, things like that. Of course, we understand there can be a relationship to nutrition, right, and how we move. There's relationships to exposure to, sunlight and being outside and being in nature. And we've undoubtedly seen everything that I just said change a lot over the last bit, right? Now add to that, of course, the last few years and the anxiety of that and, locking people indoors, and taking them out of schools and all that. So I think that's all very real, for sure. One of my favorite people that I think is articulating this very well, that I encourage people to check out, is a gentleman by the name of Dr. Roger McFillin. And he's a clinical psychologist. I know we mentioned that book, Bad Therapy. That's a recent book. And Roger's in that book. And I think what that book really does a good job of, why I really agree with that so much, is because it's actually, we're having a lot of times the wrong conversation. And not what you brought up, Autumn, but so it's like if there's a fishbowl, and I use this example a lot, right? And then the water's dirty, okay? and there's fish in there, eventually the fish are going to get sick. Now, we don't know what symptom's going to show up, right? Like whatever, fishy heart disease or fishy fibromyalgia, or fishy depression, whatever. Something's going to show up. And then we always say, like, hey, what do we need to give that fish? And we don't really think about cleaning up the water. The people that are having this depression or anxiety, all the things you mentioned, and this is going to be uncomfortable for certain people. And I don't say this cavalier. We've all had family members that have struggled with this. I've had people very close to me struggle with this, and suicide. And my mother's a master's in social work, so I'm not like I kind of know what I'm talking about, right? I mean, I'm not trying to say this lightheartedly to anybody, but a lot of this is we're looking at we're still treating the symptoms, right? We believe that there's something. The response that these people are having is largely because they're in such a jacked up environment. Their response is actually normal, right? Like it's normal to be depressed if you scroll 9 hours a day, comparing yourself to everybody else in an artificial environment alone in your basement staring at a blue screen. Like for you not to be depressed would actually be weird. Right? For you to not have, a circle of friends or influence, to be separated from your creator, to be told all the time that you have anxiety, and every time you go to the doctor and you're labeled with these things and you're told. Now, I'm not denying the existence of anxiety or depression. That's not what's happening here. I'm saying it's actually it's not a disease that you catch. Now, some people that will trigger. They'll be upset that I said that, right? But again, the science is on my side, not on their side, okay? If you want to start talking about serotonin levels or measuring this, there's no test, there's no physiological test to even measure these things, all right? So when they're giving you an SSRI or something like this, that's pseudoscience. It's not, and that's why I really recommend getting familiar with Dr. Roger McFillin. He's a clinical psychologist with over 20 years. He's a PhD. He's a researcher. He has a podcast called Radically Genuine, which really, he unpacks these now they're controversial, some of them, not because he's not right, but just because they're not the common narrative, right? And for some people, they can't handle, like I'll use it just to jump off another one for a second, something like ADD or ADHD, right? This, I don't know how old you are, but I know how old I am, right? So grew up in a time when I was a kid, that wasn't even, I'm 45, that wasn't even like a thing. Nobody talked about that, right? And now, and it's a construct that's been made where we label these kids, right? Because we have them in an environment, we're feeding them junk food, locking them in front of a screen, telling them to sit in the desk, 9 hours a day or 8 hours a day, whatever. And then when they don't do what we want them to do, we call that ADD. Now, again, are there extreme situations where people need interventions and help? I'm not denying that. What I'm telling you is those numbers that you said, which are real, but those numbers, the answer to that is not more pills, not more diagnosis, not more labels. We've played that game, right? Like that's where we sit. We've been doing this for 20 years. We've been given more labels, more surveys, more schools checking kids, more this, more that. And all we have is more depression, more anxiety. We don't have more resilient kids. We've got more, kids that are afraid to move out of their house and sleeping on their parents' couch when they're 35 years old. They play video games all day long. Now, I know this is a little bit intense, but, it's part of, because we're not allowed to talk like this, and that's why I appreciate your show, Autumn, and your book, is because it's like saying, hey, this is time out, right? Like this isn't okay. This isn't normal. And if we're just going along with this and not able to ask just a few like reasonable questions, right? And then in that book, Bad Therapy, which is a great book, in my opinion. I know it upset certainly some people in that world, but like then this idea that everybody in the world and their dog needs therapy, I think is another big part of the problem. I have a 17-year-old daughter, and so I hear a lot of these conversations amongst girls, that age, and unfortunately, a lot of even her friends, right? It's my anxiety, my depression, my this, and they just own this. And then you're a bad person if you say, hey, time out, like what's going on here? And they treat it like it's, a virus that they caught. So I kind of, threw my cards out there. What's your take on it? Or I know you talk a lot about it in your book, but it's really scary.
Yeah, I read the book Bad Therapy, and I liked Abigail Schreier's take on it. I found it really insightful, what she had to say. So I did want to follow up with what you said, because I do see this as a touchy topic.
Yeah.
Just like as soon as you bring up mental health, it feels like you're entering kind of a scary arena. Why do you think it is that people get so defensive to talk about it? I feel like especially when you bring up, therapy and medication and just suggest that maybe there's a different route besides just an automatic prescription and therapy course. There's like this defensive posture. And just why do you think people get defensive about it?
Yeah, well, I think that there's an answer for that largely. I mean, you've seen this happen over the decades. Again, being as old as I am I remember the first Prozac commercials. I remember when they brought this to the world, calling it a chemical imbalance, right? It used to not be seen like this, right? Like we used to value courage and resiliency, and again, being from the Midwest, we used to talk about like having the Midwest work ethic, if you remember that, right? And now it's almost like if you work hard, it's almost seen as negative, right? Like, oh, you work too much. Like everybody has to just like work 3 hours a day from their home and make $200,000, and if be a social media influencer. Like we've gotten it distorted, and so when you're told it's a chemical imbalance, it's nothing you can do about it. It's genetic, right? It's just bad luck. It's not your fault. You're a victim. Okay, so then when that's been established, and then somebody comes in to say, hey, it's not that. Well, it's a rare person that once you've swallowed that pill, literally, to believe that it's, that's how it is for you, then yeah, you're going to be offended by that, because you're going to say, hey, this is just, I have a chemical imbalance. There's nothing I can do about this. And so you're telling this person, hey, you just need to, we would never say this, suck it up. That's not what we're saying at all, right? I'm just saying hey, let's work on this. What's really going on here? I'll give you just one quick example. So my sister, I have a sister, and when she was about in high school, she tried to kill herself. Okay, I mean, she wrote notes to the family. She came home. She left school in the middle of the day, and she came home and she started swallowing pills in the medicine cabinet. And thankfully, she made one quick call before she went unconscious, and to my mom, and my mom quickly called the ambulance, and they came home, and they, to my sister, and they pumped her stomach, and she was able to survive. And I remember, and I wasn't at home at the time. I didn't live at home, and so when I heard the story and everything, obviously concerned. And the reason I'm sharing this, so of course the solution that they had for my sister at that time was, right, to put her on drugs, right? So interestingly enough, she just tried to kill herself taking drugs. Their solution is to put her on drugs. In that time, it was Zoloft. Right, if you go look at Zoloft, if you look at the literally the black box warning on Zoloft, it says, right, increases suicidality and homicidal thoughts in younger generation, adolescent generation, which my sister was one of those. I think it does it beyond that, but that's just what they admit to on the box. And so my dad was a fireman. He was like, well, what do I know, right? I'm just a fireman. And my mom's a social worker. Well, what do I know? Hey, let's, if she has depression, why won't we give her an antidepressant? And my sister, thank God, she said, hey, listen. The reason I tried to kill myself, I know this is a tough conversation, but she says, the reason I tried to kill myself is not because, I didn't have enough Prozac. She goes, it's because I hate myself, right? Like, can we deal with that? Right? And I think that's what we were missing here, right? And so my sister, I talked to her about this even still to this day, and I ask her sometimes, she's a big successful attorney now and all that kind of stuff. And I said, any advice? And she says, I just tell people, like, if you're in that place, like, you have to get outside of yourself. Like, you have to go help somebody, go serve other people, go do things for other people, go, all this kind of stuff. And that's the opposite of today's message. Today's message is focus on you. Self-focus. You, self-love, self-care. It's all about you, all about your emotions, all about how you feel. Constantly think about it, constantly talk about it. My anxiety. And the world is told that we're supposed to buy in and affirm that no matter what. And if you don't affirm that, you're a bad person. Just like if you didn't wear a mask, you're a bad person. If you didn't stay 6 feet away, you're a bad person. If you didn't get the jab, you're a bad person. And I would say, actually, the opposite of those things are all true. And so I think to your question, or to your point, is it's seen like it's bad of us to bring it up, because you're like victim, bashing or something like this, because the way that it was delivered is it's not your fault. And that's how the medical model wants that to be. It's not your fault. You have high blood pressure. It's not your fault you have high cholesterol. It's not your fault you have obesity. Oh, now it's obesity, right? It's Ozempic. Everybody and their dog's taking Ozempic. It's not your fault that you're overweight. It's because, again, you didn't have enough Ozempic in your body. And so we've just been conditioned to believe that. And so we don't even question it anymore. But, generations before us, if you would have told somebody 20 years ago or whatever, 30 years ago, like, hey, there's a pill that you take if you don't, if you're depressed, they'd say, well, that's crazy. Like, what are, why, what are you talking about? We wouldn't do that. And yet here we sit, right? We're 22% or 25% of adults are on an antidepressant, antipsychotic medication. So That's my story, and I'm sticking to it,
Hmm.
Autumn.
Yeah, well, I think it's so important to get down to root causes.
Yeah.
My husband and I were foster parents,
Mm,
so we've been, involved with foster care. And there's so many kids
great example. Yeah.
that, they come into care and then they might be diagnosed with ADHD or depression or anxiety. And like you said, it's like, well, they should be troubled. Like they were just
Yeah.
removed from who knows what kind of environment. We have so much paperwork about what's happened. And, sometimes the response is, to give them medications instead of really getting
Yeah.
down to root causes or teaching them, how to move forward. So I just think it's so important, not just for individual families, but for our culture to kind of get a grasp on this, because then we see, in foster care, they're at the hands of a
Yeah.
government agency. And so,
I mean, I think foster care is a great example on them. I mean, there's been some exposés on this. I mean, I don't know your experiences with it, but you doing it, but that system is rife with just throwing medications at kids, right? Unfortunately, right? And so then they come into maybe a home like yours, and in your hands can sometimes even be tied, right, on what you're able to do and not do, and because you said, when they're under the state or the government, and it is difficult because once you know this information, and you kind of wake up to it or you see it differently, it can be really challenging. And I think you're exactly right. And this doesn't mean you don't have empathy, right? Or you're, like you said, like these kids or anybody that's struggling, I would never deny what you're feeling. That's not what I'm saying at all. I'm simply saying, hey, first of all, that doesn't mean that the only solution for you or option for you is pills. Okay, right? And also, just very, very clearly, I would tell people, and that's one of the reasons I love Dr. Rogers' work, is those pills don't do what you think they do. And so the research on those is not what you think it is, mostly. So people need to wake up to that. I know they don't like it, right? Because it kind of can challenge us, but it's really important that you know that they don't even do what you think they're doing. And so it's helpful because then you might say, hey, gosh, well, if they don't even do that, then what does work, right? Or what options do I have? And that's where, that's kind of where the scales start to fall off your eyes. But yeah, it's interesting.
yeah, and I think a lot of times, and this isn't anxiety and depression, but I was a high school teacher. And so I would see kind of the IEPs sometimes students would have. So they get some kind of diagnosis when they're maybe like 7 years old. And then I get them, by the time they're in high school. And it was very rare that I ever saw it work like that you saw them in high school and like, oh, they've made so much progress and now they don't need these extra helps. That usually was the opposite. It would grow bigger and their needs would become greater. They would have more accommodations. And I think a lot of people just don't realize when they're starting what they're getting into. They're kind of sold, like you said, they're sold that it's going to do something it doesn't do, or that they're going to, whether it's a pill or in this case an accommodation, that it's going to be a quick fix and then it'll just get better. And instead, sometimes the opposite is what happens.
Yeah, most of the time, unfortunately. Yeah, even with the road to hell is paved with good intentions, right? I mean, I think that these parents that are doing this, I think that they are absolutely. I would never, right? They love their kids deeply. They're just trying to help. They don't know what to do, and unfortunately, they get put in a system that has everything that you've described and that we've been talking about. And so, we do live in a time where you really have to be your own advocate, and you really do have to. I'm sorry that sometimes that these, the powers that be and the influence of that on these, agencies are what they are, but that's no excuse for us to just keep, blindly going down that, right? So, we do live in a time where you do have to be extra, really, skeptical or your own advocate and do some research on these things and ask yourself, hey, and still remember that ultimately you have the choice. People will tell me sometimes they'll, bring in the list of medications that they're on, and the highest I had one person on 47 different medications that came into my office. And I said, well, what do you think about this? And they said, well, I have to take them. And I said, what do you mean you have to take them? Like, who told you that? Right now, I don't take people off of drugs or put them on drugs. That's up to them. But we literally have this belief, like, since a doctor told me to take this drug, that they have to do that. And that's just not the case any more than if I told you that I recommend getting adjusted. Doesn't mean you have to do it, right? It's your health. It's your body. You can, at least to this point, for the most part, you still have sovereignty over your body. And I hope that continues from a medical freedom standpoint. But yeah, so sometimes it's just taking back, that power that we kind of unconsciously gave away to people in authority that we should never have done.
Yeah, I remember the opening story from Bad Therapy. She talks about, seeing her therapist,
Mm.
and then at one point her therapist, or she told her therapist that she was going to get married, and the response was, "Well, I don't think you're ready." And then she was like, "We're done,"
Yeah.
she just
Yeah.
left. But she was just saying that, some people they don't exercise that
Mm.
power. So I guess what would you say to someone who's maybe they think they could benefit from counseling or from therapy, because there are good counselors and therapists out
Yeah.
there, and like how do you make that decision? How do you find a good person who's going to try to get to those root causes?
Yeah, I mean, I think and not fully my area of expertise, so I take it for a grain of salt for me. But I mean, other than I see a lot of people, and I've had a lot of experience with that, and it's an area of interest to me. And again, my mom being a master's in social work, I'm not ignorant to these. I would say there's a few things. One would be, from my perspective, it's really important that the person is a person that they have a faith-based perspective, right? Like their worldview matters a lot. So if you're looking for somebody that has a secular view on this, like you use that example of like you're not ready to get married. Like, well, how are you, what are your, who are you to say that, and what perspective do you have on that? So I think it's really important that maybe I shouldn't even say a faith, but for me, that it aligns with your values is probably a better way of saying that, right? You're finding somebody that aligns with your values. Also, you're looking for somebody that has an end game, right? That has like an end point, like that you're specific about the challenge that you're dealing with. Another very good resource is a woman by the name of Mary Veaton. She runs something called, she's a PhD and clinical psychologist as well. She worked in the military for over 20 years. I've had her on my podcast as well. But she's seen the worst of the worst, right? PTSD from the war, from the field, and she was able to help these people with medications and get them off medications and such. And she always tells these stories about, like, if somebody's talking to you, maybe a friend or a family member, right? And they're saying, "Hey, I'm really struggling with this," and we often say, like, "Oh man, like you should probably talk to somebody." And Mary always goes, "They're talking to you." Right? Like we're qualified to love our friends and our family. And sometimes we're the best thing for them. We've got this belief system that you have to go to some person with a degree, with that to get well. Like it's the same thing. Like, the gym I work out in or whatever, like my trainer or my, whatever leader at my gym is way more important to my health than, some doctor is, right? Just by keeping me accountable to, my fitness levels and things like that. And so I say this to say, a good start, and then align yourself with some people that are psychologists, or, I personally would stay far away from psychiatrists. That that generally the reaction there very quickly is drugs. So if you're not a person that wants drugs, I would be very hesitant to enter into that industry. So then you're looking at more like mental health therapists, clinical psychologists, things like that. Which again, there's some very valuable things in those industries. But I would find people that are skeptical of their own profession, right? And that's by whether, again, I keep bringing up Roger as an example. I just think and so find those people that you identify with that like are seeing this through the worldview you're seeing this. Like that was the other thing I think that she said in her book was like, I just kept having another problem that we had to focus on, right? Which is, that's life. Like that's all of us, right? Like it's actually normal to have ups and downs and peak moments and bad parts. And that doesn't mean that you have to have a counselor for that. It doesn't mean that you don't, okay? But also it's not a given. And that's why it's called bad therapy, right? This reality that therapy can be damaging to you. Getting you to come in and talk about how bad your life is all the time is not a roadmap to victory. That is a way for you to continue to focus on why things are bad, and your worldview becomes looking at bad, how the world's treating me, what's wrong. It's the same thing that happened again through the last few years, which is all of a sudden we saw the whole world as dangerous, from your grocery cart to your mail to your, the air on the street. And so it changed people's perspective. So when you start to see yourself, hey, I'm resilient. Hey, I can overcome these things. Hey, this is a lesson for me to learn from. Hey, what are some skills I need to develop? And if you are, so much, if you so much don't have that muscle developed, then you might need some professional help, but you may also just need your friend or your, the amount of, counseling I got from my grandmother is way more than anything I ever got from, some paid psychologist or something. And I've seen counselors over over the day. One time, I'll tell a quick funny story, and this is maybe I've never shared this publicly. It's a little bit weird, but so when my mom was a social worker and she went to college while I was like younger, so I remember her getting trained, and then one of my first kind of like puppy love, like high school, sweethearts. She was older than me, and I was really jealous. Okay, and so I was struggling with this. I thought every time she didn't call me, she had another boyfriend, and it's just kind of, my own issue, right? Well, my mom thought I was, too jealous, so I needed to go see a counselor. So I went to this counselor, and we sat down, and he goes, well, tell me, Ben, tell me about whatever's going on. So I told him this, and I'm telling him about this girl, and then he goes, well, he asked a few questions, like, well, how much do you hang out? And it was that puppy love. So, I mean, it was like we were together every waking moment and hung out every weekend and talked on the phone. And then he just finally looked at me after about a half an hour and he goes, so let me get this straight, and he just basically told me back everything I told him. He's like, when do you think that this person is, like has all, you're like, you're kind of, Ben, you're off. You're off. You're not seeing this right. Right. And I remember getting up saying, and I was like 16 or something. I got up. I didn't even make it the whole hour. I got up. I said, thank you. That is exactly true. And it's like the light bulb switched for me. I left and never saw him again. And I think he did a beautiful job. He just told me the truth, right? And he said, Ben, your perspective is wrong. Now we've changed it. It's all affirming. It's all, so much of therapy can be, and I'm generalizing some therapy. There's some great therapists. Many of them are my friends. But just to your question on that, I think don't be willy-nilly about it. Don't just do who's covered by your insurance. Don't just, find referrals. Find people that you think are resilient. Ask the questions. It's okay to fire your doctor. It's okay to fire your psychologist or your counselor. And most of the time, you probably don't need one. Just like I would say the same thing about doctors. I would say the same thing about a lot of that, right? You don't need them as much as you think you need them. Most of it can be done through your own network of people, right? And in your faith and your, just lifestyle and the things that we've been talking about on this show. So.
Thank you so much. So we're going to jump. Our last segment is called Let's Get Personal. Uh-oh. So it just kind of coming from is the personal story. So my husband had foot surgery on his tendon, and he was away at the time. So I drove a few hours to the hospital where he was and kind of got there after the surgery was done. And I remember being in the hospital room when the doctors kind of came in to follow up, and they're talking about, taking a blood thinner, and then they started talking about, pain medication and what he might need. And in that moment, my mind immediately jumped back to after he had his wisdom teeth pulled, because they had given him oxycodone. And he took one, and he had like chills, and he never took it again because he had reacted to it. So our immediate thought was like, no, we don't want anything. We'll just kind of go over the counter if he needs anything, which he never even did. But I just remember how casual it felt. Like it almost felt like we could have just said, oh yeah, he's definitely going to need something really strong. And they would have kind of just given us whatever we wanted. And then it made me think about, I've heard some people talk from Teen Challenge who, like I remember one testimony that was his story. Like he had surgery. He was given a strong medication. He was never able to get off of feeling like he needed it. He became addicted. And it just, had so many challenges in his life after that until he went through Teen Challenge and got off of it. And so it just made me think that, like, what if we just said yes and took the strongest thing that they would give us? And so I'm just wondering, just from what you've heard and the people you've talked to, like, do you think this is really uncommon, or do you think this is, like, other people have kind of been there as far as the way hospitals handle pain medication?
Yeah, well, no, I think unfortunately it's incredibly common. The number one thing that leads to addiction to opioids, right, is prescriptions from pain, right? I mean, primarily back pain. And so, I've had it. There's not a day that goes by in my office where I'm not working with somebody to either try to get them off of opioids, right, by helping them because they've been addicted to them. I've had some very personal stories of people in my life where literally, they ended up in prison. Right. They got, started off with taking a pain pill. And this is why, again, we have to have this perspective. Some people get frustrated with me sometimes because they go, man, you beat up on medicine so bad. And you just sound like you just hate that. And I said, well, no, listen, the reason I do it, because if you don't have that perspective, like you think that, if I say heroin, you think that's crazy, right? You think that's, you'd never do that. But when I say, the doctor comes in and prescribes you some, oxy post-surgery, like that's different. And I'm just here to tell you that chemically, these drugs are very similar and very bad and very dangerous. Okay. I don't care if you bought it on the street or if you got it at the pharmacy and it was covered by your insurance plan. Any more than people don't like to talk about this, but drugs like Ritalin, they're very much chemically identical to a methamphetamines, to meth. Well, nobody would give their kid meth and like feel good about it, right? You'd never say, hey, Ricky, before you go, take some meth. You wouldn't do that. But we like the effects of them sometimes, right? And so we go, well, but again, to go back to the cocaine example, you would never think that I'm doing myself a favor by using cocaine. So we have to know how bad and dangerous they are. People don't realize the Sackler family, if you go and read about any of that with Purdue Pharma and you do the history. Now, we're just talking about opioids. Frankly, you can put any drug in here. But you're right. Most people don't know how bad they are. They don't understand how they came to market. They don't understand the addictiveness of them, the physiological dependence upon them. And so then they find themselves in a place they never, ever, ever thought that they would be. These drugs are insanely addictive, whether they tell you that or not, right? And whether they deny it or not, that's not the case. I just had a friend. He had hernia surgery just a couple of weeks ago. And I was catching up with him, asking him how it went. And he went to this really kind of almost a holistic type of, it was a freestanding clinic, and the doctor is more of a holistic minded guy. But when he got done, he said, hey, you're going to need these pain pills. And he gave him, these packets of the pain pills. And my friend happens to be a chiropractor, and he's not, into that. And he goes, well, like, honestly, doc, do you think I'm going to need these drugs? He's like, oh yeah, you're going to need these drugs. Like, let me tell you, right? So my friend was like, I'll see how it goes. And so long story short, he never took any of them. He never took any painkillers. Not because he's some big tough guy. He would tell you that. He's just like, it wasn't as bad as I thought. I laid around. Not sure I wasn't moving, but so I think a lot of times what we end up doing, like to your point, Autumn, we end up taking these drugs like, oh, I better take it because the doctor said, or, we're starting to wake up from surgery and, our leg hurts or whatever. I get it. Totally. And some people need to take the medication if they want to take it, but most people don't. And I would just encourage you, again, if I looked at that drug and I say, man, there's a possibility that I could become dependent on this, then I'm going to do everything I can to not take it. Okay. But again, this goes into just culture. We've deemed, much like we did with like depression, anxiety, like it's been seen as, you can't talk about it, like with you're shaming them, right? Now, like pain has become that too. Like if you talk about, trying to tell somebody to like, not take something for their pain, you're seen as like an evil person. And there's a reason for this. This actually happened partly due to Purdue. They actually created pain as another vital sign, which had to be talked about in every visit. And if you had pain and you didn't give the patient something for that pain, that could be considered malpractice. So there's insidious things that happen where all of a sudden doctors started asking you about your pain. They used to not necessarily ask you about it, not all the time. And they certainly didn't feel like they had to give you something for it. And if they didn't, then they were literally at risk of losing their license or getting a malpractice claim. And then surprise, right? Here's the pill to give you to do that. And so, unfortunately, especially because of the work I do, being in chiropractic and helping people physically a lot of times, it's and I've done it for long enough, 20 years. So I've seen this progression, right? I've seen, people on more pain pills and addicted to more pain pills, and it destroy their lives than I've ever seen in my life. And so I, encourage people to, again, I don't put people on drugs or off of drugs, but I would encourage you to do everything you can not to do that. All right. And yeah, that might mean sometimes you're going to have pain. Listen, it's okay. It's okay. Like we can hurt. It's okay to have pain. Like I said before, many times that pain is actually the body trying to tell you, hey, lay down, and so I would just be really, really careful. And again, those, it's hard to get addicted to a drug that you never take, right? So, there's a lot of value in just trying to avoid that. But hopefully your husband's doing okay.
Oh yeah, he's doing good now. But thank you so much. Thank you for your insights that you shared with us. Thanks for joining us on our show. We really appreciate having you. Before we, fully wrap up, do you want to just share kind of where people can find more information, if they want to get a copy of your book or hear your podcast?
Sure. Thank you. And it's been a pleasure to be on your show. You are willing to talk about things that many aren't, right? And your book was fantastic. And, we don't. I think we like to bury our heads in the sand sometimes. We don't want to think about these things because they sound scary, or sometimes they sound like conspiracy theories or whatever, right? But unfortunately, they're not. I wish they were. I wish they were, right? We'd move on and talk about something else. But this is really important stuff. So great job with the work you do. Um, Probably the best way, our Design to Heal podcast. If you like conversations like this, or we bring a lot of experts on as well to talk about these issues. That's probably the best way to follow me. I do have a website, just my name, drbenrall.com, BENRALL.com. You can order, I've written a couple of books, one on healthcare, and then one, The Design to Heal, is a daily devotional. So I just went from Genesis to Revelation and have it just pulled out all the healing scriptures. And interestingly enough, I thought with the healing scriptures, when I did that, I didn't know how many there would be. I didn't know if I'd have enough. There was certainly enough. But then also about 70% or so of them are actually have to do with mind, right? It's about, anxiety and fear and these types of things. And so it really was fascinating, just as a wake-up call for me, that the Lord had a lot to say about health, of course, but he also had a lot to say about our mind and our mindset, some of what we talked about today. So that, and then I am in practice. I do have a clinic in Orlando, Florida. I know you have people all over the world that listen, but for that's where my clinic is. I don't do any telemedicine or anything like that, but if you are in the area and you need a chiropractor, certainly our clinic's called Achieve Wellness.
All right, well, thank you so much, and thanks again for joining us, and thanks to everyone tuning in and watching this episode. Feel free to leave your comments below. We'd love to hear your thoughts, and remember to live in truth.